Hey everyone, it's Dr. Reams here with Dr. Reams Concierge PT. I'm here today with my Aunt Sherry. She was diagnosed with breast cancer. I don't know which age because I was pretty young, and she was living in Australia at the time. So I brought her on to talk about her experience and how now she is in a role supporting her daughter through this diagnosis as well. So welcome, Aunt Sherry.
Thank you. Hi.
So when were you diagnosed and how did you kind of find it? Was it a routine exam or was it a self-exam? Kind of what happened there?
It was in 2002.
Okay.
And actually my husband found it, found a lump in my breast. And, from there went to the doctor and got biopsy, etc.
Okay. What's the process kind of like in Australia?
I would say it's similar. What I have noticed now that my daughter's gone through it too is I would say they place much more urgency on it.
Okay.
So I literally got my biopsy and knew the results before I even left the lab.
Oh, wow.
Yeah.
That's
and
incredible.
had an appointment with the surgeon within 2 weeks.
Wow.
And yeah, and in getting surgery, I'd say within a month at the most. So I would say they place more urgency on it.
Yeah. A little more efficient with their time.
Well, I thought,
Yeah.
and also they monitor you for 10 years over there.
Okay.
So I was very disappointed when I came back here after 5 years and they said they basically didn't want to know me.
Wow.
So yeah.
Yeah.
That was different.
So you had surgery. Did you have lumpectomy, mastectomy? Kind of where did you fall in there?
I had a lumpectomy.
Okay. What grade? Do you remember what grade you had
It
or
was a stage 2.
stage 2? Okay.
Yeah.
Lumpectomy.
And 3 of my lymph nodes had traces of cancer in them.
Okay. So did you just have the 3 removed or were there more removed as well?
There were 8 removed altogether.
Okay. So my mom, when she went through it here in the States, they removed like 15 lymph nodes.
Really?
And they weren't in any
Wow.
of them.
Wow.
Just to kind of compare, granted it goes doctor to doctor as well, not just countries, but
Yes.
yeah, so there's often a difference with that. And from my experience, your experience in Australia is closer to what we're doing now here. Less lymph node removal, stuff like that.
Yeah.
So
Yeah, I mean, some of what Amber is going through is the same. Some of it was a little different.
Yeah. Did you have any radiation or chemo?
I had the whole thing. I had exactly what Amber's doing.
Okay.
Interesting fact. When I went through it, I was actually on a trial for what then was a new drug, and of course, called Herceptin.
Okay.
And Herceptin is like an immune, I'd say blocker, trainer, whatever you want to call it.
Yeah, it's immunotherapy.
Yeah, it's immunotherapy. And Amber, when I went into the oncologist with her, I asked, why are you doing surgery or doing chemotherapy first? Because I did surgery, then chemotherapy.
Yeah.
And the answer was because that drug significantly reduces the tumor.
Oh.
Kind of cool that I was on a trial, which has proven to be such an awesome drug for the breast cancer world.
Oh, that's awesome. And now your daughter is able to benefit from those trials back when you went through it. Oh, that's awesome.
And it happened to her. Her tumor shrunk immensely.
Oh, that's fantastic. It makes surgery so much easier.
Yeah.
When you were going through radiation and chemo, did you have information provided to you from like a nurse navigator, or how were the doctors kind of helping educate you and helping you through this foreign territory, really?
To be honest, like up front, they gave me a bunch of information and that was kind of about it. I was lucky that I had a couple friends who had been through it and they offered me suggestions that weren't there, and things I heard Amber didn't hear either. Things like your mouth becomes extremely dry and sensitive. So to switch to toothpaste that's for the dry mouth and mouthwashes, etc. The other thing that they didn't tell me of course, Amber knew being a nurse, but that every single hair on your body falls out.
Yeah.
Not just your hair, which we all know.
Yeah. Eyebrows, eyelashes, everything.
Yeah. All the way around.
Head to toe.
And then the other thing a friend gave me, which I was happy Amber kind of followed the suggestion as well, as just when your hair starts falling out, just shave it.
Yeah.
That was such a horrible experience for me when it first started falling out.
Yeah.
You like scratch your head and your whole hand is full of hair.
Yeah.
Traumatic. You wake up in the middle of the night with hair all over your pillow. So shaving it was like freedom.
Yeah. You don't have to worry about that clump coming out and that shock at that point.
Yeah.
Taken care of, basically. You took control of it.
Exactly.
Yeah. And that's one thing that I notice some facilities are better at than others, is giving education and talking. And part of what I'm doing is to help people get as much information as they can, because everyone is different. They'll have different experiences, but if you kind of hear, oh, that did happen to someone, I'm not alone.
Yeah.
It can help.
And I think that's awesome, Kaylee, because that was one thing that I think was of help to Amber, because she was able to ask me, did this happen to you when she started getting some of these things happening in her body that she didn't have firsthand knowledge. So for me personally, I would have loved somebody just to tell me everything that could possibly happen, so I was ready for it.
Yeah, and if you know something's a possibility, you may catch it sooner and can help it better then.
That's true too. Yes, I agree.
Because you're kind of there and can stop it sooner sometimes, or have a trick.
Yeah.
Oh, my nausea got really bad with this medicine, but not that one.
Right.
This lozenge is better, whatever it may be, right?
And I have to put a plug in for you because it's true. I think of all of the people who helped me through all this, my physical therapist was probably the best.
So you did see a physical therapist at the time?
I saw a physical therapist a couple times. I got cording.
Yeah.
I got cording really to the point where I couldn't even lift my arm up.
Yeah.
And she was awesome with that. And I also got lymphedema really bad.
I didn't know that.
Yeah. I mean, like, my arm's swollen really bad. And both times, not only was she really good at solving it, but she was good at helping me understand what I could do to prevent it from reoccurring, particularly the lymphedema.
Yeah.
And I did the massages for years.
Yep.
Based on what she gave me. So yay on physical therapist.
Yes. No, I'm so glad. And, again, Australia is ahead of the game. They know that that's part of the care team. And so they get you there. Doctors are pretty good when it comes to like the shoulder motion, but a lot of them kind of lose track with cording or lymphedema.
I agree. Yeah.
And as you've experienced, when you catch it sooner and learn what to do to stop it in its tracks, it's much easier to take care of.
Yeah, I agree.
Did you go through any of the compression sleeves or anything like that, or still wear them occasionally?
Yeah, I don't now, but I wore one for years. At first full time, and then backed off to just like when I was on an airplane or when I'm in those high risk.
Okay, so you're one of the lucky ones that can get away with the kind of high risk times and not lifelong all the time.
Yeah, no, I mean, and nowadays I would say I can tell when it's,
you learn what your body responds to.
Exactly. And then take care of it then before anything happens. So I haven't worn a sleeve in years.
Oh, that's fantastic. I always tell my patients, because I've met other people that have, right, that their body adapts and they don't have to lifelong, but there's never a guarantee. But it's always exciting to hear. It just reaffirms that I'm telling the patients the truth, that there's a possibility.
You're telling them the truth. It is true.
Okay, so how long were you in Australia after you finished treatment and we're doing follow-ups there?
I was there for 5 years.
Okay.
So 5 years of treatment after the fact, I guess.
Okay. And follow-ups, typical scan.
Yes. In fact, that's the other thing. I think Australia is just a bit more careful. Maybe that's the word for it. I would get checked once a year, not only the full blood test, but I also would get a gated heart scan, I think they called it.
Okay.
Because, and I can't remember which drug it is, one of them actually can affect your heart.
Yes.
Yeah. So I thought that was awesome. Here, no, they don't do that here.
No. Unfortunately, in my experience, is a lot of the doctors here, and they're getting better about it, but let's treat the cancer. We treat the cancer. Okay, our job's done.
Yeah.
Right. And they
Yeah.
kind of forget the treatments of the cancer now cause other things that we have to watch.
Exactly.
And so not just from our hormones, but from the heart to our lymphatic system.
Yeah.
Everything.
Yeah. And, you know, and I'm sure you'll probably get this, but there's after effects that at least I personally will have for the rest of my life. From,
Yeah.
You know, so it would have been nice. Australia was really good, but it would have been nice if they'd caught some of them and made some suggestions early on.
Yeah. Or at least, you know, made you more aware of it so you could get your resources in order to kind of figure it out rather than fighting later, saying, no, this is what happened.
Yeah. And one of them is I have extremely dry eyes to the point where I have eyelashes that grow like into my eyes, that grow in odd places on my eyes.
Yeah.
And so, yes, I have to see a doctor who specializes in, we caught it early, maybe it had not been so bad, but it's things like that.
There's a lot of the mucosal tissues that get affected, the eyes, the mouth, vaginal wall, all of that stuff. You know, bowels, those get affected that people just don't think about. One, because we don't like to talk about it, but two, because there's a lot of other things going on.
Well, yeah, I mean, that's another thing that has happened since my chemo hasn't gone away is when I have to go now. Yeah. It's, you know, there's no man of trying to do muscle tightening. It just doesn't happen. So.
Yeah, there's changes, you know, one in hormones, right? Yeah. And then two, just in muscles and the chemical reactions in your body. And so there is some stuff because of all my training that can help with some of that urgency, right? Yes, it would have been a lot better sooner. Right now, there's been years of training in the body of that.
Like money.
So it's much harder of a battle. But someone in like Amber's situation, right? That if she started to experience urgency, that you can start to kind of retrain it and stop it in its tracks so it doesn't get as bad.
Right.
And so there's a lot that people don't look at or know or ask about because they don't know.
Well, that's exactly right. Well, and you just don't think about it. I mean, we all know that when you go through chemotherapy, your hair is going to fall out. Mm-hmm. But I think that's the extent of what we know. Yeah.
Is you're going to feel sick. Your hair is going to fall out. You'll be tired.
Exactly. Yeah.
But that's kind of all that's talked about.
Exactly.
And so one thing on my docket of videos to make is to interview a dentist. Because chemo can affect oral health, cavities, all that.
Okay.
But now that you mentioned in kind of the eyes, I need to go talk to this optometrist that I know because she's all about stuff. And so.
Yeah, that would be a good idea because they actually discovered that I had dry eyes when I was going through chemo, but I guess they just assumed it was temporary. Yeah. And it wasn't until, it's really only been maybe 7 years ago that I finally went to a dry eye doctor and they said, oh, it's caused from chemo. Yeah. So, 13 years later.
Unreal, right?
Yeah. So it would be awesome to inform people up front.
Yeah. So thank you for giving me that tip because I'm always learning more and more. I know there's all kinds of stuff that happens, but until you get people to tell you, you don't know.
Very true. Because nobody has anything written down about all those things.
I know one doctor that just moved into town, I have a meeting with her next week, actually is creating a list of resources for patients, how to get financial help with food, what doctors in town help with oral health, with physical therapy. And I'm like, this needs to be a gold standard.
Great idea. Speaking of food, now I didn't really have that issue, but I know that Amber watched her diet very carefully and was very adamant about what she put in there, which would be so helpful to share with people.
Yeah, absolutely. And I've seen a few boards pop up about kind of breast cancer food and a
Yeah.
lot of stuff like that.
But I don't think people think to look at it, Kaylee.
No, but that's what we're
Right.
feeding our body, nutrition, and it makes sense when you
Right.
think about it, but when you got everything else going on.
Yeah, that's why I like that idea of her creating resources, because that's you really need to, I guess, say no that you need to know about that.
Yeah. Yeah. And even though, and she does it because she's well aware when someone gets told they have cancer, not much sticks for a while.
Oh, absolutely.
You can
No,
tell
totally.
them that this may happen, but it may not stick. And
Yeah.
so having a resource that they can go back and be like, oh, there's something about food, right?
I totally agree. I mean,
And
that's why
so,
when Amber met with the oncologist the first time, I'm like, I need to be there.
yeah.
Because I need to hear what she says. And it proved true that Amber, there were pieces Amber just didn't recall, because you're in such shock.
Yeah.
You know,
No one can blame you for that at all.
yeah.
Your world just shifted dramatically. And so I know Amber had some trouble kind of with her stomach and stuff like that going through chemo, right?
Correct. Yeah.
Yeah. So that was pretty
Yeah.
significant for her.
She-
How did she kind of manage going through this diagnosis? Because her kids are young
Yeah.
and then working in healthcare. So she has kind of that other side of it that you get a biased view because you work in the healthcare system. So you don't see the
Correct.
healthiest people.
Yeah. You know, it was really hard on her.
Yeah.
Really hard. Still is. I mean, at least she's making it through it. But the fact, if you think about it, that potentially you may not be around for your children, that's a devastating thing to think about.
Yeah.
And that was probably where all her focus went, right?
Okay. Yeah.
What if something does happen to me? What do I do about it?
Yeah.
Yeah, it was very hard on her.
Yeah. How old
And
was Amber when you got diagnosed?
okay, I was 48. So I just have to count this up. She would have been, I know, take away.
Math.
Yeah, exactly. Take away 25.
Okay. So she was old enough to kind of understand what you're going through and stuff.
Oh,
How did she
absolutely.
handle her daughters? Because they're so young.
Oh, she was so great about it. You know,
Yeah.
she sat the girls down and let them know that mommy's sick.
Mm-hmm.
And she's going to have to, go through some treatment, and there'll be times when she'll feel well, etc.
Yeah.
And the girls were great. I mean, the youngest, I don't think totally got it. She's 4.
Yeah. Yeah.
Went over, but the oldest, she was really good about it.
Good. Because I know my mom, she didn't share when she was going through it.
I know that.
So everyone makes a different decision.
With her about it. I'm like, I need to know.
I knew because it's me, but
Yeah.
But everyone makes a different decision. So it's just good to hear kind of different stories. And, her girls are so young. And so that's a hard conversation to them not fully understand.
But I think, but you have to put in perspective, especially for Amber, because hers was stage 3.
Yeah.
So the girls missed out, still are missing out a bit on a lot of things, well, and COVID on top of it, right?
Oh, yeah. Yeah.
So essentially their house was in lockdown for the last year.
Yeah. No
so
choice but to
understand that there was a reason why they, couldn't do things with their friends, why they couldn't go here, why they couldn't go there. Important. And I have to say, when I first got diagnosed, I didn't want to tell my mom.
Yeah.
Because I was all the way in Australia.
Yeah.
But my oncologist looked at me and she said, how would you feel if your daughter was diagnosed with cancer and didn't tell you?
Yeah.
So I don't know.
Reality check there.
Yep. Yeah. So.
Yeah. How did Grammy take the news when you told her so far away?
She was pretty good. You know who fell apart? Grandpa.
I believe that.
He really,
Especially because he likes to control and stuff. So being so far away and not being able to help
I think he's just more of a softie than he shows on the outside.
Okay. Yeah.
That's what it was about.
Yeah.
Thought of him maybe losing his daughter. That was
yeah. Poor grandpa.
Yeah.
But so Amber is still going through the process. She's almost done, right? A couple more treatments.
Yeah, she middle of June. She's in her immune therapy right now.
Yeah.
I don't know why I can't get that one out, but yeah.
I mean, so you guys are in San Diego, I'm in Tennessee, just for people who are watching this video. So I'm seeing this experience through Facebook.
Right, yeah.
So that's why I'm asking these questions, is we're a country apart. But I mean, she's looking beautiful and strong in her photos and stuff like that, which
Yeah.
Facebook does.
She's doing really well coming out of the chemotherapy and radiation. She is actually, and I can't remember the name of it, she's on a different immune therapy than I was on. They took her off Herceptin because they found microscopic particles of cancer in her blood test.
Oh, okay.
So she's on a new drug that has, I guess, a very small amount of chemotherapy in it.
Okay.
So her immune levels are still, her white blood cell counts are still pretty,
Yeah.
they're not where they should be.
Yeah. Still immunocompromised and all that. Yeah.
Yeah, but still better than she was with chemo. So she's
good.
I'm happy to see she's starting to do things and get out there.
Yeah, that's what I started noticing, is more family photos and stuff like that, as that shows me that she's feeling a little bit better. Yeah. She's showing more of herself. Is she noticing any other side effects, related to cording or tightness from radiation or anything like that?
She did when she was going through radiation. It's gotten better. The PT finally released her and said you were at full motion, which is great.
Good.
Yeah, so she's still doing her stretching.
Yeah.
But I think, and she got burnt quite badly with radiation, but that's healed up as well. And a lot of what she has happened to me too. So
you were able to kind of help her and talk through it, and
well, and I think more than anything of making her feel like it's not just her. Kind of unfortunately normal parts are going through all of this. But
did you notice anything from her healthcare team, like a nurse navigator or anyone trying to help her navigate the process besides, you guys and family and whatnot?
Yeah, I mean, I think that Kaiser, which is who she was with, had a really good care team together.
Good.
And it wasn't, like in my case, it was really just the oncologist.
Yeah.
For her, she had like 4 or 5 people on her team.
Perfect.
That would all just kind of discuss her treatment and get back to her. So I think.
And, her being a nurse as well, she also knows different questions to ask and stuff like that. So that may help.
And that can be good or bad.
Yes, it can.
Because I will tell you, sometimes I had to, pull her off the ceiling, like, Amber, like, you're going way to the extreme. Like,
you're way down the track. Come here.
She's always thinking worst case scenario, right? Which that's what happens when you have the knowledge. Yeah,
absolutely. Because of our family history and all that stuff, I have to go get a mammogram every year and an MRI every year.
And that's good. I think that's excellent. Amber actually had the testing done, and they say it's not hereditary. However, at the end of it, the lady who did it said, with everybody in your family that's had it, I think it is hereditary, but there's just no tests yet.
Because I did the genetic testing and none of them came up positive either.
Yeah. And that 2 of my cousins had it too.
I did not.
And young. Yes.
I did not know that.
Yeah. My, one was young. My cousin, and I don't know if I want to say names because she doesn't like anybody.
Yeah, no, that's fine.
one of them was only like in her 30s.
Oh, wow.
Yeah. And then the other one was probably a bit older. She was probably in her 50s when she had it.
Okay.
So.
And even stronger family than I thought.
And Grammy had it.
Yeah.
Yeah. So
I didn't know that one.
We definitely have it in the hereditary as far as I'm concerned.
And then I also have it on my mom's side. So.
Well, that's right, Kaylee.
Doctors look at my list and go, oh.
Yeah. So good thing you have all that knowledge.
Yeah, and I'm best friends with my breast surgeon, and we're checking it regularly. So.
That's awesome. That's important.
Preemptive and all that stuff. So having the knowledge and reaching out to resources that we have, community, family, all of that stuff is really important.
Super important.
Was there anything that you found or Amber found kind of more to today and all that like a website or a support group online or anything that you would suggest people look up or anything?
I think, to be honest, Amber, like she and her husband researched everything. So she might be a really good person to ask that question to, because they researched everything. I did, I only did it like if she gave me a medication, like when she told me about our new one, I looked it up, but I didn't go out proactively looking at things.
Yeah. Wasn't sure if there was something that was good that like, oh, I wish more people knew about this. Sometimes things pop up like that.
Yeah, I agree, but reach out to
Nothing
Amber.
particularly.
Nothing that I know of. And when I had it, the internet didn't exist. So. No, it existed, but we didn't access it.
Wasn't the same thing by any means.
It was not the same thing, no.
And do you know about like the YMCA Live Strong program? Do you know about that?
No.
So YMCA across the country has a free to cancer survivors program. That's a 6-week cohort that they take you through an exercise program. It doesn't matter how long after diagnosis it is.
That's cool.
Yeah, and so that's one thing that I try and tell a lot of people about. One is it gets you around other people who've gone through similar things.
Yeah.
But it also helps you get your strength back, get some of your function back, all of that stuff.
That would have been really good immediately after. I mean, I was fortunate that I was like walking distance to a gym. So I went back pretty much right away.
It's fantastic.
But I had to be careful because of lymphedema, right? So baby stepped into what I could do. And I walked every morning about 5 miles. So I
so you were active. You guys now bike all the time.
We do. Yeah. We bike most days 10 miles and on the weekends anywhere from 20 to 30 miles a day.
It's fantastic.
Yeah.
So continuing to live that healthy lifestyle, and even though there may be side effects 20 years later, there's still stuff you can do to help your body stay healthy.
Well, exactly. I mean, it's just, there's nothing you can do about it. So you just got to deal with it and move on, right?
Yep. One day at a time and be the best you can be.
And to be honest, to me, it's super important. I've always been very active. So, but it's super important to me, even more so now that I'm getting older, because I don't want to be that old lady that people see who can hardly walk or move or, I'm determined I'm going to keep rolling.
And I think that's pretty true throughout our family too, is I don't think you know this, but when Dad had his hip replacement, I had just finished PT school. He made me come out in the middle of the street and record him walking and show him what he was doing wrong. So he could recover right.
Yeah. And good for him.
Yeah. And so, you watch, Tammy and them, they're all dancing and all that stuff. And, our family's pretty good about that. And I think that shows, it helps you feel better about yourself. And
well, and I think it keeps you alert mentally as you get older.
Oh yeah, there's a lot of studies about that.
Yeah.
But is there anything I didn't ask kind of about your journey or Amber's journey, or now being a support system for your daughter through this process? Because that's a change in roles, big time.
I mean, probably if there's anybody listening who's dealing with the same thing, I think the biggest suggestion, because I happen to be somebody who wants to fix everything, right? That's my personality. I had to learn to back off and not offer the fix, but to ask the right questions so they could get to what was the right thing for them. For Amber in this case, rather than like I know for a while there, she was debating whether she should just stop doing her radiation because she was getting, and I said, well, let's talk it through. And now I needed her to come to that decision. So that was probably a hard thing for me to go through, but it would be advice I would give anybody.
Yeah.
Don't make the decision for them. It's like you said, everybody's different. What was right for me was not necessarily right for Amber.
Yeah. And also, I've seen it from the other side too, is, Amber's going through all this stuff. She wants to have some control. So also if you come in and want to fix things, that's even more control you've taken away from her.
Well, that's a really good thought too. I didn't think about that. I just thought I can't make, and I've said that to her, I can't make a decision for you.
Yeah.
I can offer things to think about.
Yeah.
But I can't make those decisions for you.
That's a really hard thing to do on your part.
It is, especially when you're the mom.
Yes.
It's hard enough to do, but when you're the mom, it's really hard.
Yes. And I've witnessed it a lot with a lot of my patients, is the husband or the mom want to come in and fix it for them. They love them. They want to try and help them and fix it. And there's a few things you got to think about.
But that said, sometimes I did have to say, I'm doing this. Like,
yes.
You know, Amber didn't feel well. She couldn't do simple things like the laundry. And poor Jeff, he's working full time, taking care of those kids, taking care of it.
Yeah.
So I was going over there and doing the laundry, but at first they were like, no, mom, you don't need to do that. So I finally had to say, no, you know what? I'm doing it. I'm coming over this day and I am doing your laundry.
Yeah. Yeah. There's that line you got to find of.
So yeah.
This is where I'm going to help.
That's right.
You gotta let me help you.
Well, and that said too, Kaylee, to people who are going through it, because I had to say this to Amber too, there are times in your life when you just have to accept people's help and say thank you. It's really hard to do, especially when you're used to being independent. And I know both Amber and Jeff had a hard time with that, but it's like, just step back. People want to help. It makes them feel good. It helps you out. Just say thank you.
Yeah. It's hard on both ends, and everyone's trying to watch each other's feelings. And once you kind of figure it out, you see what was going on. But in the thick of it, it is a difficult thing to do.
It is. It's very hard to accept the help that you get, because that, I will say the two things when I came out of all of this way back when is, it made me realize how kind people really are. It's amazing the things people do when there are situations like that. And B, it helped me say, don't judge people, because you just don't know what they're going through.
You have no idea what battles they're facing. And
and it's true. It's really true.
Now, you were in Australia, so your support system was completely different than what Amber has. She has friends, family around. You were with Michael at the time, right?
Yeah, I was with Michael.
Okay, so you had, a significant other and friends, I'm sure.
Well, most of our friends were down in Adelaide, and we were up in Brisbane. So
okay,
I had a couple of girlfriends that were close by, but that was about it. So Michael is my saving, because again, when you're going through chemo, you're so isolated. And he would take me out every Sunday and we'd just go somewhere. Yeah. Which was really good for my sanity.
Yeah.
Got me
step away from all of the other stuff. And so finding at least one person to, help you through it, and every situation is going to be different.
Yep, absolutely.
So, okay. I think that's all I really thought of to ask you.
Okay, I'm trying to think. I can't think of anything else really off the top of my.
But I really appreciate you sharing your stories and your perspective from the journey yourself, and helping your daughter through it, of all people, and all that stuff. And I learned a lot.
Good. I'm really happy to help, and any questions people may have, happy to help answer them if I can.
Awesome. Thank you so much, Aunt Sherry. I really appreciate it.
No problem. Good
I'll
to
talk
see
to you later.
Okay. Bye.
Bye.